Respiratory 202, Chapter 23. Surgical disorders in childhood. Choanalletresia. Can be unilateral or bilateral. Occurs in 1 of every 700 births with a 2-to-1 female-to-male ratio. 50% have associated congenital anomalies. The best diagnostic tool is to use a number 8 French catheter in the oropharynx. If it won't pass, it may indicate choanalletresia. Bilateral choanalletresia is a neonate emergency and requires intubation. Open mouth crying that resolves cyanosis may also be indicative. Their prognosis is excellent as long as it is without complications. Macroglossa is associated with other disorders. It is easy to diagnose using a polysomnography and a pulse ox. Mild cases can be treated by laying in the prone position. Severe cases may use surgery to reduce size. Mandibular hypoplasia. Treatment includes lying in the prone position, an intraoral or nasopharyngeal airway, and surgery. Esophageal atresia and tracheoesophageal fistulas. There are 5 anatomical classifications. Esophageal atresia with a distal tracheoesophageal fistula. Esophageal atresia with proximal tracheoesophageal fistula. Esophageal atresia with both proximal and distal tracheoesophageal fistulas. Isolated esophageal atresia with a long gap of missing esophagus. And tracheoesophageal fistulas without an esophageal atresia. Here is an image of what the 5 types look like. Chest wall malformations. Pectus excavatum, which is most common. Pectus carinatum, which is usually from growth spurt. Asphyxiating thoracic dystrophy, which is where all of the chest cavity is decreased and pulmonary development is often blunted. Scoliosis and kyphoidosis, if severe, can lead to secondary chest wall deformities. Lung bud anomalies. A bronchogenic cyst is within or outside the thoracic cavity. It makes up 10% of mediastinal masses. The treatment is surgical removal. Congenital cystic adenomatoid malformation results in a hamartoma, which is a disorganized overgrowth of embryonal tissue. It is a benign tumor that is removed through surgery. Lung bud anomalies continued. Pulmonary sequestration is an accessory lung that is a formed lung with no connection to the tracheobronchial tree. Treatment involves a resection. Congenital lobar emphysema is a overdistension of one lobe. Air can enter but not exit. Necrotizing enterocolitis. 90% of cases are premise. It has multifactorial causes that lead to ischemia and necrotic tissue. It presents as abdominal distension, feeding tolerance, rectal bleeding, abdominal wall erythema, and distended bowel loops. Treatment can be surgical, which is a possible dissect and reconnect. Respiratory 202, Chapter 26. Pediatric airway disorders and parenchymal lung diseases. Click here. Respiratory